Hi, I'm Jack West, medical oncologist at Swedish Cancer Institute, and I wanted to talk today about an idea of how I think that the practice of oncology should potentially change over the next several years and decades to provide the best specialty care to people everywhere without having to have people travel so much. And that's specifically with the idea of telemedicine helping us bridge the distance gap between specialists and patients. What we're seeing now, and we're really living through this in real time, is such an explosion of new information that it's no longer possible for a general oncologist to keep up with all of the developments that are happening in the optimal management of all the different kinds of cancer. It's becoming more and more important to be specialized in hopes of keeping up with the newest clinical trials, the newest mutations and other tests that are being developed, and some of the therapeutics are becoming so complex that it's just a very, very challenging thing to hope that a general oncologist would be able to keep up with the exploding amount of information out there. And yet, in much of the US or other parts of the world, there is not a specialist in your particular kind of cancer who is readily available. And so you can either take your chances with a general oncologist that might or might not have the knowledge of the latest tests and clinical options, or you can drive or fly somewhere to get a specialty opinion. But the fact is that we have the technology, and it's being practiced very routinely to do video-based consultations and conferences in so many aspects of our lives. Skype is readily available as a way for even older people who are not that technologically savvy to communicate regularly via video and audio with their grandchildren. It can be that simple, and we have the hardware and we have the bandwidth now to do this pretty routinely. It's done in business settings and other settings, but it's been slow to be adopted in medicine. Where I would see a great potential is as we are moving towards these large networks like Kaiser Permanente, like Swedish's connection to the Providence system, even the military. There are many growing large networks that are really changing the landscape of medical practice in the United States, at least. And it's certainly you have one large system in places like Canada and much of Europe, for instance. So what I would love to see happen is that people can get their local care from the doctors closest to them where they have the most support, but that these systems avail themselves of the opportunity to connect to the best experts within that system. There might be one or a handful of breast cancer experts, lung cancer experts, lymphoma experts, Parkinson's disease experts, whatever you need. You can avail yourself, if you have lupus, of talking with the best person for lupus in the Kaiser system or the Swedish Providence system or any of these. And then get that care delivered close to home, because you actually have a collaboration between the specialist, who may not be anywhere nearby, and the more general physician, oncologist, etc., who is close to home and who has a longer-term connection with the patient. Another important point is right now there can be disincentives for patients to be referred by their local doctor to a referral center when that patient may be lost to the local doctor's practice, which frankly has financial implications. In a new system where we are all part of a team, you have a network, it's not that one patient's consultation means that it's being lost to someone else. A patient can get all the benefits of getting their local care and still have the opportunity to consult with a specialist a few times per year, or whenever there's changes in the plan or changes in the circumstances that require a reevaluation. And then essentially you can have the person best equipped offer a blueprint of what to be built, what should be built close to home, and that can be executed right by the local team with the backup of the specialist wherever they might be. That's my idea. I would love to say that my own network is working toward doing this, but it's a process that represents a significant change in how things are done. And I don't know if that's going to ever happen, or at least happen anytime soon with the Providence and Swedish arrangement. I think it's the kind of thing that Kaiser Permanente or the Canadian province system or the UK's healthcare system, the NHS, should be doing something like this. It's just too good an idea. I'd love to learn what other people think about this and see if this is what you would like to have if you don't have a major specialty center within an easy drive of you. Take care. Bye-bye.